Hi, this is Bill Pong. This is week number 4, chapter number 6, case number 1. Did Mrs. L act correctly? Well, Mrs. L acted correctly as a committed healthcare professional to protect the patients. She's obligated to protect the organization, her profession, as well as the patients. This included ethical obligation to maintain and improve healthcare, the quality of healthcare. So as healthcare professionals, not only we have an obligation to avoid evil, but a specific obligation to prevent evil from happening to patients, such as the patients from the nursing home in this particular case. What should she have done if she could not afford to consult a lawyer? Well, Mrs. L could have reported this to the hospital's risk management, corporate compliance, ethics committee, and even board of directors anonymously. However, her identity might not have been protected because she was suspected to be the reporting party after the first initial report of abuse to the authorities. So those with the greatest responsibility are formally charged with preventing evil. Ethics committees focus on how organizations function as a system, decision-making process, the flow of institutional power, and correlation between basic values and the organization's operations. So she needs to refer to organizations' mission, vision, and values, as well as their policies. She also needs to understand her organization's culture of compliance, integrity, and the enforcement of their policies. In this case, her leadership have not aligned to their values, but have placed their financial gains above patient care. In what ways can whistleblowers protect themselves? Well, whistleblowers can protect themselves by reporting anonymously to their own organizations, risk management department, the government agencies, or regulatory agencies such as CMS, Joint Commission, Department of Public Health, and even state boards. So whistleblowing is needed when the chain of command doesn't work. It should be last resort after a series of interventions. So whistleblowers do need it because those who remain silent are basically consenting, and the inaction of the good people is the main reason why bad people continue to harm patients. However, whistleblowing should be limited to rare occasions. For occasions that are repeated of nature, that are seriously harming the patients, but not the occasions that are isolated incidents. The repeated abuse in the Shady Rest nursing home is a good demonstration of a case that where it violated patients' right repeatedly. So Mrs. L must consider potential consequences, including getting worships fired, blackballed, and counter charges when whistleblowing. She should expect the worst, such as being criticized and humiliated. There is also a possibility to resign when evil becomes too monstrous. So must the art of intimidation be part of the tool chest of healthcare professionals in order to protect their patients? Well, intimidation should not be the normal means of protecting patients in healthcare, but it should be reserved as a last resort when all other means have failed. Is power an appropriate consideration in healthcare ethics? Well, power in healthcare is no different than compared to any other business. It is to be dealt with when unethical decisions are made that results in repeated harm to patients or to the public. Chapter number 6, case number 3. Have the nurses done enough to report the problem? Well, it doesn't seem that the nursing has done enough to report this problem other than informing the nursing director. Given a number of incidents, including close calls, violent behavior, and that the staff are fully aware of Dr. Baracco's alcoholic addiction, nothing has been done to help him and to protect the patients at this point. At a minimum, there should have been incident reports filed with risk management, ethics committee, credentials committee, or even medical executive committee. The fact that a nursing director have not taken any actions speaks to the culture of the organization. Should they go elsewhere in the hospital, such as the physician peer review group? They can absolutely do that. Healthcare professionals, including nurses, physicians, should have reported these incidents to the organization's patient safety or risk management system or department. It could also be addressed by the Physician Credentials Committee, the hospital's ethics committee, to help determine its privileges, the risks of malpractice suits for the organization. There might be a sense of loyalty to the group, or afraid of retaliation as well as financial consequences. However, none of these contribute to protecting the patient from repeated harm. So physicians and other health professionals have the obligation to police their own members and to protect both patients and the public. The consequences could be more severe as if the public would judge an impaired physician more severely than his fellow peers. The organization and health professionals have an obligation to protect the patients and the profession. This is to see that Dr. Baracco gets help for rehab. The law on impaired professionals provides an exception when healthcare professionals are under rehabilitation. Should they use a group outside the hospital, such as media, the State Department of Health, or the State Nursing Association? Well, groups outside the hospital should be reported, such as the AMA, to allow physicians to receive help and also protect both patients and the profession. State boards should be contacted to address if the physician is fit to practice medicine. Media should be avoided, as this often does not resolve the problem, and when we tend to rely on media to tell the truth. In some cases, they don't. Should patients be encouraged by nurses to file official complaint? Well, patients have the right to file a complaint, but it would be more appropriate for nurses and fellow physicians to report these unacceptable and dangerous behavior. Often patients are not equipped to judge if the physician is competent or not. Nurses and other health professionals should report these behaviors to the organization's patient safety system. However, the hospitals are required to inform the patients have the rights to file a complaint to the Department of Public Health or the Joint Commission.